and welcome to the Weekly Review, a program of South Network making sense of relevant topics and news. My name is Alfred, Yoron. I'm the producer and host. Today, we are joined via Zoom from Juba by Dr. Anthony Garang. He is the chairperson of South Sudan Doctors Union. Welcome to the program, Dr. Garang.
Thank you, Roger, for having me on this program.
Today, we shall be looking into the state of COVID-19 pandemic in South Sudan and related issues. So this week, it was announced that the number of COVID-19 cases in the country has risen sharply after the Ministry of Health confirmed 47 new infections over a 7-day period. And the cumulative number of confirmed COVID-19 cases in the country stood at 3,061, including 60 deaths. The chief of operations for COVID-19 at the National Emergency Health Center, Dr. Angelo Bob, was quoted as saying the new cases include local transmission and imported infections. Dr. Garang, what's the response or the views of the South Sudan Doctors Union on these new developments in the country?
First of all, thank you very much for hosting me on this program. South Sudan Doctors Union appreciates the work of the Ministry of Health that it is doing with the limited resources. You know, Ministry of Health in South Sudan is not like any other Ministry of Health in the region. Why? Because this particular ministry is struggling, with a very small, limited budget because health sector in this country is underfunded. And therefore, those who are working at the ministry, they are really doing their best in order to ensure that the little resources that are given are used effectively in order to meet, the healthcare needs of the country. We also really appreciate and commend the work done by the healthcare workers at the Public Health Emergency Operations Center, and especially, those healthcare workers working at the Public Health Laboratory, because they are dealing directly with a dreaded pandemic that is actually is carrying the whole world, and they are there every morning, every evening, trying to do their best in order to confirm the cases. The EOC management, is also doing great by keeping us, the public, informed, and this is what you just mentioned, that, this week, they had a press release where they mentioned that the cases are spiking. This to us is really true, and if you can recall our previous press release, we actually mentioned that, COVID-19 is not yet over, and we need to make sure we are prepared to respond, because the region around us is already experiencing, second wave of infections. And, our borders are open, both by land and air, and cases are coming in. Plus, also the people have started, to lose this compliance. They are not compliant, actually. So one cannot be surprised, that that cases are rising. That the number of cases are rising because we have a border that is open. We have activities, economic activities that have resumed, but the people are less compliant with the measures that have been put forward by the Ministry of Health.
Yes, actually, talking about your last press release and compliance, indeed, last month, the Doctors Union reported to say that they are concerned that the coronavirus disease national response, coordination, and leadership roles are shrinking, while public compliance with COVID-19 prevention measures is losing momentum. And you called on concerned authorities to reinforce COVID-19 preventative measures. Maybe you could elaborate that more to our audience and also the concerned authorities.
Thank you very much for bringing that up. In fact, we are very concerned, deeply concerned, that the authorities that were tasked in order to oversee, coordinate, or lead this response to the COVID-19 is are actually seemingly relaxed. Why am I saying relaxed? It's just because we don't see more activities going on. For example, the meetings of the National Task Force have reduced now, and this is the platform where issues are brought and discussed, and then decisions are made, and then the Ministry of Health implements those decisions at their level. Also, we are seeing there used to be activism, going on. You see government officials talking about COVID-19 as a dangerous disease. We don't see, these figures nowadays, talking and reminding citizens to take care of their lives and make sure COVID-19 is prevented. We also don't see, we have also seen that the schools have been reopened, and the economic activities have actually resumed, but without clear guidelines to those people who are going to resume activities, economic, whether school, learning, church, whatever. There are no strict guidelines given by the authorities. Yes, there are rules and regulations put forward for prevention of COVID-19, but no one is enforcing them. So we feel like, authorities are relaxed, and they don't want to make sure these measures are enforced in the places of work, places of worship, places of learning, so that people keep reminded that these are the measures and this is how you should prevent getting infected from the COVID-19. And we have also seen that there is a reduction in calling for more resources in order to continue to effectively respond to COVID-19. This is also a work of the authorities. Some NGOs or partners or civil societies that were very actively engaged in creating awareness and also calling for coordination and resource mobilization, they are not doing that anymore. So you can see that this thing is kind of like people are relaxed. Yeah, they presume that the COVID is over, but it is not yet over. It is next door. People are dealing, the world is dealing currently with a second wave. So that is why we issued that press release, in order to remind authorities that COVID is not yet over. We need to continue to exercise our roles and responsibilities as they were assigned to us, and continue to remind our people that, COVID is still here, or it is here to stay. Do 1, 2, 3, 4 in order to protect yourself and your family from getting infected.
And how is the relations between the doctors' union and the government, especially the task force on the fight against COVID-19 pandemic? Do you see observations or recommendations being taken seriously, being implemented?
Thank you for that question. In fact, our relationship with the government is very cordial. So far we have been collaborating. We have been working with the government, especially the Ministry of Health and the National Task Force. The South Sudan Doctors Union is actually a member in the National Task Force. We sit there and we also bring up issues and concerns that we get from the health facilities, from our doctors, and from our observation in the COVID-19 pandemic response activities. We usually give our views there. And of course, they are taken seriously. They are taken positively, because what the Doctors Union says comes actually from the doctors themselves who are doing the response, and also it comes from the masses who actually complain to us. Sometimes they bring us issues and concerns that needs to be looked into, and we table them before the National Task Force, and they are discussed, and decisions have been made, and we have seen some of those decisions being implemented. And also, we have a cordial relationship with the Ministry of Health. We are also part of the National Steering Committee, which is led by the Ministry of Health, that meets regularly every Thursday. And there we also bring up issues, and they are discussed. And our doctors also participate, in developing, some guidelines and some things that are actually required from them. So I can say our relationship with the government is cordial. Last week, we had a visit to the governor of Central Equatorial State to remind him about this COVID-19, that Christmas is approaching. He should also put measures to ensure that, people are safe from COVID-19, because Juba city is the host of a bigger urban population. And therefore, we want to remind also the governor, who actually appreciated and welcomed our visit to him. So our mutual.
What were you able to come up with, like, as the outcome of the meeting, resolution of the? I saw the news was circulating online, but what was the outcome of the meeting?
The outcome was positive. The governor actually assured us of his support to Doctors Union, and also his support to our activities. And he also took it upon himself to ensure, health sector allocation is increased. When the budget for the state comes to their table, they will ensure that the health sector is given more attention, because this is life of the people. And he also assured us of joining us in the advocacy and lobbying the national government in order to ensure more resources are allocated to the health sector. Plus, also we called for joint efforts to establish an intensive care unit at the Sabah Children's Hospital, or any other major hospital in the state of Central Equatoria, or within Juba itself, in order to save lives and reduce, loss of lives, due to just emergency situation that can just be contained if we have an ICU.
Well, as we are almost winding up, tell us more about the Doctors Union. Our audience would like to know. So, what is it? How does it operate? And I mean, the structures and its current programs.
Well, Doctors Union is a professional body that represents doctors, medical doctors, dentists, and pharmacists in South Sudan. Doctors Union advocates actually for quality services, but we also ensure that rights of doctors are respected and observed, so that we achieve the excellent delivery of health services. And we also usually cast our views on the policies by the government that affect doctors themselves or affect the profession and access to quality services. Doctors Union structures is actually of three tiers. The first is the General Assembly, which is the supreme authority of the union. And then we have a council that is made up of 25 members of the council. And then we also have an executive committee that comprises of 9 members who do actually day-to-day activities of the union. And then we have a secretariat, which is actually doing the daily activities, the nitty-gritty details of the union. Our vision as Doctors Union is a South Sudan where everyone has access to decent and equitable health services. And our main objectives is actually to ensure decent health services for the people of South Sudan and the people in South Sudan. We don't discriminate. Our programs mainly are advocacy and in order to create an enabling environment for our work. And we also support training of the medical professionals. If there are scholarships, we also try to prepare them in order to ensure they they get those scholarships. We also raise awareness, on health issues and also on the diseases. We also promote scientific research by holding symposiums, and we also give technical support and advice to authorities, when necessary. And we participate, in the planning of health-related projects when we are invited to participate. And finally, we actually do social and recreational activities for our members in order to relieve the stress, from the work they are doing every day. And the last is, of course, resource mobilization in order to build our financial base. And membership of the Doctors Union is open to all the medical doctors, the dentists, and pharmacists that are registered with the South Sudan General Medical Council.
So far, how are things going? What are your major challenges? And how do you think you could be helped?
Major challenges, of course, are the resources. Doctors Union is only getting resources from its members, and members, when the members have enough income, then of course there are enough resources from them. But you have seen, the kind of life doctors are living, the payment that is being given to them is not adequate enough. So we have issues with the resources. We don't have enough resources. Also, in the country, there are a lot of competing priorities, and whenever we give our opinion or technical opinion or the call on authorities to act on some issues of concern, we will find that of national concern. So sometimes you will find that activities related to improving the healthcare sector or health systems are not well implemented just because there are other competing priorities in the country. And we also we still also have to build relationship with the private sector, for example, the business people. It is still a challenge because right now we need to actually ensure that we get to have some investment activities ongoing in order to generate more income for the Doctors Union.
Well, finally, what is your message to the government and the task force on COVID-19 pandemic and the people generally in the country as far as COVID-19 pandemic, the fight against COVID-19 pandemic is concerned? Also, you could also tell to the other development partners, the final message.
All right, thank you very much. In fact, our message to the National Task Force, because it is currently the national body that has been entrusted, the oversight and the leadership of the COVID-19 response in the country, we are reminding them, to go back and do their work, implement their roles and responsibilities as assigned by the president. We need to ensure COVID-19 is fought in this country in an effective way. We don't want to be a reservoir of the coronavirus when the whole world or the neighbors have eradicated, or have fought back COVID-19. We need to ensure lives of our people are protected, and that is why a big task has been given to the National Task Force in order to coordinate this effectively and lead, and also make a lot of resource mobilization so that we have some resources to implement this. To our government, right now we are relying on partners to support, this fight. Thank you for the support you gave, but that is not adequate. We need to see more resources being injected by the government into this COVID-19 response, and the people belong to the government, or the government belongs to the people, and therefore we need to make sure the resources that we have are prioritized and injected into something that will save lives, from this dreaded pandemic. To our partners, we really appreciate your support and standing with us during hard times of this COVID-19. we would actually ask you to continue to support us until we are strong and stand on our own feet. And to our people, COVID-19 is an international health emergency. And we, as part of the international community, need to make sure that we comply with whatever is prescribed by the Ministry of Health, by the WHO, by other health-related agencies, if that can save our lives. You know, protecting yourself from COVID-19 is actually an individual responsibility before it becomes a national or a government responsibility. Wearing a mask is not a big thing. You know, wear it when necessary. For example, when you're going to crowded places, to closed buildings, wear your mask. When you're going to the market, wear your mask. It doesn't kill. Doctors have been wearing masks all their lives. Also, please sanitize. Make sure you wash your hands, make sure you sanitize, and make sure you protect also your family members. Okay. This is my appeal to you. Let us continue to exercise the preventive measures and observe them very well and comply with them as other regions are doing. This is my message to you. COVID-19 is real. It is not a hoax. It is not something made up. It is killing people. It affects people differently. So if it doesn't affect you now, you can still be a means of transmitting to other people, especially your family members. So please make sure you wear your mask, sanitize, make sure you have social distancing when you are in a meeting, when you're in the market, when you're in the car. Try to take charge of your lives. Thank you.
Well, with that, Dr. Alfred and Garang, thank you very much, and we've come to the end of the program.
Thank you for having me, and thank you very much for hosting us on today's program.